Good evening. Assalamu alaikum. Thank you so much for joining Crescent Private Wealth's collaboration with the Triangle Health Insurance Agency. My name is Kashif Osman, and I'm thrilled to provide for you and welcome Sister Aroona Zaeem from the local area. We'll talk about Medicare Made Simple, understanding your 2026 options. We're joined by Dr. Aroona Zaeem, who has for more than 13 years had the privilege of serving our community as an independent licensed insurance agent. One of her passions is helping individuals and families find the right coverage at the right price, whether that's Medicare plans for seniors or the ACA, Affordable Care Act, or Obamacare health plans for those under 65. She takes pride in making the insurance process simple and personalized, always working with individuals' best interests in mind. Outside of work, she enjoys reading, traveling, and spending time with her husband. They have 3 wonderful adult children, and I'm thrilled to welcome Dr. Aroona Zaeem. Today's webinar is an intro and kind of a kickoff of a partnership we'll have with Dr. Aroona joining us in the Crescent Raleigh office, Crescent Cary office. Next week, she'll be here from Monday to Friday to answer any questions in drop-in and appointment sessions regarding Medicare and open enrollments. Without further ado, I'd like to kick it off to Dr. Aroona to present to us Medicare Made Simple, understanding our 2026 options.
Good evening and assalamu alaikum. My name is Aroona Zaeem, and today I will talk about Medicare. It is a very confusing subject, and everybody goes through that when they turn 65, and more than often they get confused. So today I will talk about basics of Medicare so that it is simple to understand. If you have any question while I'm talking, you can put in the question answer box, and I will answer as we go. Let's start. So first of all, who is eligible? Medicare is for adults that is over 65 years of age. So when you turn 65, you are eligible for Medicare as long as you have paid your, if you have worked 40 quarter in the US, and you already paid for your Part A premium. So that premium will be zero for you, but you still have to pay for Part B premium. Individuals who have disability for 24 months, they can also apply for Medicare, and individuals who have dialysis after 4 months, after the 5th month, they can apply for Medicare. So Part A and B, if you see your Medicare card, you will see it is red, white, and blue, and in the bold word, it will say Part E, A effective date, so-and-so, and Part B effective date, so-and-so. So what does that mean? It means that Part A covers hospital stay and hospice. As I said before, that it is zero premium for Part A if you or your spouse work for 40 quarters. With no work credit, the premium varies from $278 to $506 per month, depending on how much credits you have accrued. Part B will cover doctor's visits, laboratory, and radiology. Premium for Part B varies from year to year. This year, it is $185 per month. The 2026 numbers are not here yet. They will come at the end of the fall. If you have full Medicaid, then you will not pay any premium, either for Part A or Part B. Part A premium depends on the income. If you and your spouse make more than $185,000 per year, then your premium is not 185, but will go up accordingly. This is depending on your income-related monthly adjustment amount. That is calculated by the Social Security when you apply for Medicare. They look through 2 years tax returns, and then they decide how much premium you will pay. But in general, it is $185 per month. If you do not sign up for Part B, when you become eligible, there is a penalty for Part B delay. You can delay it if you already have insurance through your employer and you are working, but if you do not have any insurance and you do not sign up for Part B, when you sign up later, you will sign up with the penalty, which will be 1% per year. Medicare does not cover prescription drug. So if you have a card with say Part A and Part B, you can go to the doctor, you can go to the hospital, but you cannot get the prescription drugs. So how we can use the medical benefits for the Medicare? You can use Medicare only. Once you get the Medicare card, you can use it to the hospital and the doctors. But remember, you do not have prescription drug coverage, you cannot buy the prescription. And another thing, if you do not sign up for prescription drug plan when you are eligible for Medicare, there is also a penalty which you have to pay once you sign up with Part D. The second option is you can keep Medicare card, plus you can add prescription drug plan with it, so that you are covered with doctor visit, hospital visit, and the prescription drug plan. But remember, Medicare only cover 80% of the cost, 20% still you have to pay. And also there is no cap. There is no cap means there is no maximum cutoff for Medicare. So if you get sick more, you will pay more. The third option is that you can get Medicare and Medicare supplement plan, which is commonly called Medigap plan. Again, when you get Medicare with the supplement plan, it also does not have prescription drug plan, and you can have to buy 3 of them. So you buy Medicare, Medicare supplement plan, and Part D. The fourth and more common option is the Medicare Advantage plan, which is commonly called Part C. So we will talk about them one by one. So if you have Medicare only and you don't wish to buy prescription drug plan, you can still use it to the doctor's office. You can still go to the hospital, but remember, you cannot buy the prescription. That will cover only 80% of the total cost. There is no cap on the maximum. In 2025, the Medicare Part A deductible is $1,667 per benefit period. And one benefit period is 60 days. It means if you are in the hospital and then you are discharged and there's nothing happened during those 60 days, when you go back again, you will pay the deductible again. In regular health insurance, the deductible go per yearly, but in this case, it is only for 60 days. Part B annual deductible is $240. And as if you have only Medicare card, then you have to pay these deductibles for Part A and Part B, and also you have to pay 20% of the cost that Medicare does not cover. As I told you before, the benefit period lasts only for 60 days. It means when you are admitted to the hospital or a skilled nursing facility, it ends 60 days after you are discharged from any inpatient hospital or the skilled care nursing facility. If you go back into the hospital after that 60 days, then the deductible start all over again. So with Medicare only, you don't have prescription drug coverage. And when you sign up for the prescription drug coverage, you will pay a late enrollment penalty, which is applied if you don't have prescription for 63 days. The second option is Medicare and Part D. In this case, you still have Medicare, which cover only 80%, still have no cap, but you have prescription drug plan. So you are covered with your doctor, with the hospital, and the prescription drug. The late enrollment penalty is calculated as 1% of the national average premium, which for 2025 is $36.78, multiplied by the number of months you are without prescription drug plan, and then added permanently to your premium. So for example, if you don't have insurance for 12 months, then it's going to be $4.40 per month. That number is for 2025. For 2026, it is going to go up another $2. So you can think that $4 you are going to pay every month on top of what you are paying for the premium. So now we talk about Part D. Part D is a prescription drug plan that you have to buy to get the prescription. There are 3 stages. That is deductible stage, and you paid 100% of the cost. That is only applicable to tier 3 and 4 and 5 drugs. So if you are using these generic medication like blood pressure medication, metformin, cholesterol, then you will not pay anything or no deductible. The deductible start with tier 3 drugs like Ozempic, Farxiga, Trulicity, and all those prescription medications which are brand name. So when you go to the pharmacy at the 1st January or after that, you will pay the full deductible. So that deductible varies from plan to plan. Some plans have $100, the maximum is $615. So when you met the deductible phase, you will go to the initial coverage period. In the initial coverage period, you will pay anywhere from 18 to 25% of the cost of the prescription until you reach $2,100. So the maximum that you pay for your prescription in 1 year in 2026 will be $2,100. Once you reach that, then the catastrophic stage reach when you will pay $0 for your prescription. So if you're taking more than 2 or 3 brand name prescription, you reach your limit probably in May or June, and after that you do not pay any premium or any cost for your prescription. So as I told you before, there are 3 stages. One is deductible, second is initial coverage phase, and third is the catastrophic phase. The deductible phase depend on your prescription coverage plan, $0 to $600. Initial coverage phase when you reach $2,100, and then after that, catastrophic when you pay nothing for your prescriptions. So in 2025, there was called Inflation Reduction Act was passed, and that they took care of the donut hole. So you don't have donut hole anymore. The annual out-of-pocket maximum, it decreased to $2,100 from $6,000, and the replacement coverage gap discount program with the manufacturer discount program. So now we are adding more and more drugs toward the true out-of-pocket maximum. Sometimes when you take vitamins, they are not considered as the out-of-pocket maximum, but now they're adding more and more. So it changes every year. So you have to look what the medication or what vitamins have been added this year. So we talk more about the Inflation Reduction Act of 2025. The benefit structure, the Part D benefit structure was updated into 3 phases instead of 4. We took care of the donut hole, so there is no donut hole. Out-of-pocket threshold is now $2,100. Coverage gap discount program is eliminated and it is replaced by the manufacturer discount program. So what does it mean? That every year the CMS adds some commonly used expensive medication and they bring down their cost. So right now they are working on the blood thinner. I don't remember the name of that. The next portion is 2 out-of-pocket maximum. So the IRA will update what count toward your, as I told you before, some vitamins are also considered as out-of-pocket maximum. The Medicare prescription payment plan, there's something new that has been introduced. Now you can pay your prescription drug coverage in 12 months installment. For example, if you're taking expensive medication and you know you will end up paying $2,100, instead of paying them in one go or 2 or 3 times in a year, you have to pay 12 installments. So that installment will go to the prescription drug plan that you have contracted with. So they will take out the money every month, so you don't have to pay anything when you go to the pharmacy. This will help when you go and get the sticker shock at the beginning of the year when you have a high deductible. So you can talk to your company, whoever you are contracted with, and they will work out a plan for you, and you can pay them directly, either monthly for with the credit card or the check, or go through your bank account. So this will help you to even out those the costs. So you don't have to pay $400 the beginning of the month and then go back down. So the annual deductible is the maximum is $615 at this point. So it's the same thing all over again, but now we know that 2026, the out-of-pocket maximum is $2,100. So anything over that, you will not pay anything. So we eliminate the coverage gap, also known as donut hole, and then out-of-pocket cost spending. You can choose how you can spend the money. You can pay as one, or you can spread it out throughout the year. This is called M3P Medicare Prescription Payment Plan. As I told you before, at the beginning of the year, you have to talk to your insurance company, and they will set up a payment plan for you. If you already have one set up, you don't have to redo it again. It will automatically re-enroll you. So the third option was when you have Medicare and you buy Medicare Supplement Plan and Prescription Drug Plan. So Medicare Supplement Plan is also called Medigap Plan. So different Medicare supplement plans are available. These are plan A, N, G. G is the most common one, and they all also depend on the premium. So these are not premium free. You have to pay a premium every month for these plans. So the most common is plan G. In this plan, when you pay your deductible for Part B, which is right now $240, once you pay that, then everything that Medicare cover will be covered by the plan G with no cost to you. But there is a high premium for that. It ranges from $80 to $100 plus. And every year it goes up 5 to 10%. So in Medicare, they do not offer any prescription drug plan, or they do not offer any extra benefits. So when you have Med Sup plan, it's just the health. So it's Part A, Part B coverage, doctor visit, lab, surgery, everything, but no prescription, no dental, no vision. So if you opt for this option, you have to pay 3 premiums. One is for Medicare, one is for Medicare supplement plan, and one is for PDP plan. The third or the fourth most common option is Medicare Advantage plan, which is commonly known as Part C. So the Medicare Advantage plan are the most cost effective. They cover your Part A, Part B, and they also cover prescription drug plan. They call Part C or MAPD, Medicare Advantage Prescription Drug Plan. So they will pay your Part A deductible, Part B deductible, and the prescription drug plan. These plans are run by private companies, and they vary from state to state and from county to county. MAPD plan, they cover the 20% cost of that Medicare does not cover. And the structure is based on a plan that you have no deductible, and there is the standard cost that you sign up. When you sign up for the standard cost they offer. For example, when you sign up a plan, you know what your co-payment is going to be. For example, if you sign up a plan, there's no copay for your primary doctor, but there's a copay for specialists and then hospital days. So before you sign up, you know how much it's going to cost you. And they also give you a maximum out-of-pocket money so that you know how much you will end up paying at the end of the year. This is called maximum out-of-pocket, or it's a cap on your how much you are going to pay. So that vary again from plan to plan, from $2,400 to $9,700, depending on the plan. And this maximum out-of-pocket does not include the prescription drug plan maximum out-of-pocket. So we are talking about two different things. One is for Medicare Advantage and one is for your prescription drug plan. So all the Medicare Advantage plan, they have a premium, which can be $0 to $81, depending on what plan you have, what county you are in, and what state you are in. Most of the plan, they include preventive care at $0. So preventive care means you can have 1 mammogram, you can have a physical, you can have colonoscopy. If it is a screening only, when it is diagnostic, then you have to pay the cost. MAPD plan have primary doctor copayment, which can be $0 to $20, $25, depending again on the plan. Specialist copayment can range from $20 to $50. Inpatient hospital pay is also a fixed fee. So you have to pay a fixed fee number of the days you are in the hospital. So it does not matter if you have surgery, if you have a childbirth, if you have any kind of problem inside the hospital, they all consider as number of days. So if you are in a hospital for 1 day, you can pay anywhere from $200 to $250 or $400, depending on the plan. And it also varies from plan to plan how many days you will pay. In some plan, you only pay for 4 days, regardless of how much time you spend. So for example, if you have a plan who only require you pay for 4 days and you are in the hospital for 10 days, you will only pay for 4 days. Insurance will cover for the rest of the 6 days. Similarly, if you have a plan which cover only 6 days, then you will pay for 6 days. So this is how it works, and you know at the time of sign up how much you're going to pay for that. So in emergency care, every plan covers emergency care. You go to the emergency room and there's a fixed fee. So that fee also varies from plan to plan. But if you are in the emergency room and you are admitted into the hospital, then the emergency fee will be waived, but we will start the payment for the hospital stay. The emergency care is also covered outside the US. If you are visiting your family or you are planning to have some vacation outside and you get sick, you are still covered under these plans. They also cover ambulance, land or air ambulance, chiropractor services are covered, observation days in the hospitals are also covered, ambulatory surgeries, and urgent care. They are all covered by the Medicare Advantage plan, and every service have a copay. So Medicare Advantage plan also cover portion of the Part B, that is your diagnostic test, lab, X-ray, CT scan, MRI. Procedures are also covered. That could be inpatient or outpatient procedures like cataract, a knee scope, or laparoscopy, or these kind of stuff. Or you can have a procedure inside the hospital like total knee replacement where you stay in the hospital. Skilled nursing facilities done is also covered after you stay 3 nights in the hospital. It means that when you have surgery or something and you don't have anybody take care of you at the home, you can stay in this facility and they can help you to recuperate. Home healthcare service is also limited. Mental health services like outpatient, inpatient, physical, speech therapy, occupational therapy, chemotherapy drugs are covered, but they still require 20% from the patient. So if you are having chemotherapy and you receive chemotherapy in the hospital, this will go towards your Part B and you will pay 20%. But if you are using chemotherapy medication through the pharmacy, then you have to pay your Part D deductible and everything else. You also get diabetic supplies. You also get durable medical equipments like braces, CPAP at 20% cost. Prostheses are also available at 20% cost. So still continuing with the Medicare Advantage plan, in addition to the Medicare, they give you that is not covered in the regular Medicare is routine eye exam. They give you glasses, contact lenses, dental coverage, hearing exam, hearing aids. Some plan give you non-emergency transportation, free membership in the gym. Almost every plan have that. You also get meals for 2 weeks once you are hospitalized. Once you have surgery or you are in the hospital, and when you are discharged, you get 2 week worth of meal. These are the frozen meal. These are delivered by different vendors. Tele's health service is also available 24-hour nurse hotline where you can talk to a nurse if you have any problem and you don't want to go and see the doctor or you don't have any means to go to ER or the urgent care. So you can talk to a nurse. She can guide you what to do if you need to go to the hospital or the emergency room, or you can stay home and you can get some prescriptions. Over-the-counter allowances, most of the plan, they give you some allowances, which is mostly every 3 months. You get over-the-counter stuff like bandage, aspirin, vitamins, and they are delivered, most of them, they are delivered to your home. Some of the plans give you grocery allowance, utility bill allowance, and resources for living. So if you have, this is a scenario, if you have Medicare and Medicaid both, then Part B is paid by Medicaid. All the co-payments are pretty much $0. You can get dental, vision, transportation, and hearing aids also. And you also get a flex card for the grocery, over-the-counter stuff, and utility bills. That is only available for people who have full Medicaid. And now this year they have a change that if you are only getting the allowance if you have some kind of chronic disease. So if you are healthy and have Medicaid only and Medicare, the chances are you will not get that allowances. So you have to go through, they will, the insurance company will check if you already are on that plan. They will check you if you have any of the chronic disease. If that is existing, you will continue. If not, then you will not get that allowance, but you will get everything else that Medicaid cover. So the plan that I represent in this area is Humana, United Healthcare, Aetna, Blue Cross Blue Shield, WellCare, Alignment, First Carolina, Cigna, and Mutual of Omaha. So these plans are private insurances that you can buy if you want to go for the Plan C or Medicare Advantage plan. That's it. So this is Medicare is covering for the people who are 65 or above. I also take care of people who are under 65 because mostly the population is under 65. So the under 65 people, they get their insurance either through their employer or their spouse's employer. And if you don't have the insurance, then you can go through ACA, Marketplace, or Obamacare. I also take care of those people. And in my next session, I will talk about the Obamacare. So we will talk about what is new, what is subsidy, everything that we need to know about Obamacare. That will be advertised soon by Kashif, I believe, and then we will let you know then and give you the whole description of Obamacare also. Thank you. If you have any question, do we have questions?
I have some questions, Dr. Aroona, if you don't mind.
Sure.
Yeah, of course. Bunch of questions I actually have, and a couple from the people in the chat here. So do I need to be retired to enroll in Medicare?
You have to be 65.
Okay.
And if you are still working, you don't have to sign up for Medicare. If you are getting insurance through your employer, and that is credible insurance, it means that it is the same insurance that Medicare can be, then you don't need to sign up for Part A for the Medicare. You can still get Part A, which is free because you have already worked 40 credits, but you don't have to sign up for Part B. But remember, if you lose your insurance or when you retire, you have 60 days to get Part B and then go on Medicare to provide or you prevent any subsidy. I'm sorry, the penalty.
So I have a 60-day carryover between like my last insurance and my employer drops to enroll in Medicare.
Yes, right.
Okay, fantastic. And then the open enrollment window started on the 15th, or when does it start?
The open enrollment starts from October 15th to December 7th, and that is for effective date of January 1st. Then you have one time of change of plan. It is called open enrollment that starts from January 1st to March 31st. So from January 1st, the effective date will be February. And if you sign up in February, it will be March and then in April. This is for those people who sign up by mistake or they don't understand the plan or they misunderstood. So they have one chance to switch back to the normal plan they have, or they want to switch to another plan, which is more effective for them. So just one time.
So what if I were to miss that enrollment window? What would happen then?
Then you have to stay with the plan for the whole of the year, unless you have any other SCP, like you have moved. If you have moved from one place to another place or state, if you change your, I don't think you have anything like change of marital status. I think that's about it.
Okay, that's good to know. So it sounds a little bit complicated. Like you got to kind of make sure you're picking the right plan. And of course, you're someone that people can turn to if they have questions. Is there a cost to have someone help out with picking the right Medicare plan?
No,
What's it going to cost me?
No, there's no cost to you. There's a consultation is free. We sit down with you. This is how I work when I present 2 or 3 plans, and you can pick one. It also depends what are you looking for. Some people are looking for just the regular benefit, transportation. Some people like gym membership. Some people like dental, vision. So it all depends what you're looking for. So we also make sure that your doctors are in the network. So I don't want to sign you up with some plan which is good, but you don't have the doctors, because at your age, at this age, when you're turned 65, the chances are you'd have your doctor for last decade or maybe at least 5-6 years. You don't want to change them. So we want to make sure that the plan I sign you up, for example, you come to me and you like this plan, but your doctor is not in the network. So you will go to another plan, which is not as good, but your doctors are in the network, unless you are willing to change them. So before I leave you, you will know your doctors are in the network. You will know what the prescription are going to cost you and all the other things you know about your benefit. And still, if you're not happy, you still change one time.
Okay. Fantastic.
But there is no cost for my services.
Wonderful, wonderful. What are some other considerations people kind of need to think about and to figure out what combination of coverage fits their needs the best?
They always look about their pocket. So if you are healthy and you don't go to the doctor, you can take a gamble and you can pick a plan with high out-of-pocket maximum, but no cost to you. But if you're not that healthy and chances are you are going to the doctor more often than the others, then you can pick a plan which is low in, there's no deductible, low in co-payment, low in out-of-pocket maximum, so that it doesn't hurt you in the cost. But if you can, if the Medicare plans are the one which cost you every month, but then after you pay your deductible, it don't cost you anything. Go to the doctor or the hospital or the surgery and everything else. But they are costly. The premium is on average is $100 to begin with, and then it goes up every year. So when
And
I
does my
sit
income,
down with
does my
some- sorry,
income
when I
level
sit down with somebody, I always give them the options, and then depending on their pocket, they can pick one.
Okay, fantastic. Does my income level impact how much premiums may cost me?
Not the Medicare Advantage premium. The premium for Part B will affect you. Yes, it is $185 for certain limit or a certain amount you make. For example, for a single, it's $85,000, and for a couple, is $140,000. And if you go
Okay.
above that, then the IRMA came in, which is it is called your depending on your income, Social Security will tell you how much you will pay. So if you are getting your Social Security and the Part B is coming out of that, then you will see they will send you a letter that from now on your premium will be this much because you have income level. So for example, and they look 2 years back. So for example, this year I sign up for Medicare and my income was high and I don't want to pay that much, and now I'm income is not that much because I'm retired. So you can always send a note or call the Social Security. They have a form that you can fill, and they can reduce that amount depending on your income this year.
Okay, fantastic. Thank you so much. Now, similar to just Social Security, as you mentioned, what about disability? How does that affect my ability to enroll in Medicare?
If you're on Social Security disability, then after 24 months of your disability, you can apply for Medicare regardless of your age.
Okay, fantastic. Thank you so much. We have two
And
more
if
questions.
you, another thing, if you are on dialysis, if somebody's on dialysis, after the 4th month of dialysis, 5th month, they can apply for Medicare regardless of the age.
Okay, that's good to know. Well, a couple more questions from the chat. What documents or information do I need to have for my enrollments?
You just need to have your Medicare card handy, which have
Okay,
your Part A, your Medicare number, your Part A, Part B. If you have full medical, we need to have your Medicaid number. And you need to know your prescription so that we can look through, or you should know your doctor's name. That's all we need.
fantastic. Fantastic. Thank you so much. I think you covered another question that someone asked was what things are covered and what should I get independent coverage? I think you covered that one on the list. I have two more questions. I'm curious. What are some common mistakes people are making about Medicare when they're enrolling, or common misconceptions they may have about Medicare?
Well, they just look through the premium. So the premium is not as important as the rest of the cost is. For example, a premium could be zero. There is one plan in this county which has zero premium. But if you look into the cost of the doctor's visit, specialist visit, especially the specialist, because when you are 65 and above, chances are you will go to the specialist more often than not. So if it is a $55 fee for one specialist, you talk about 4 or 5 specialists. So it's not just the premium, it's just the cost of your co-payment, cost of your hospitalization, and maximum out of pocket. Sometimes you pay a little more, but you get a lot more in return. So that is one consideration. If you are healthy, then good for you, but then you never know when you get sick. So it's a gamble when you try, because when I see people, they are very healthy. You sign up with the plan and suddenly they get sick, and now there's no other way you can do.
Fantastic. So I think definitely the biggest mistake you're seeing is people just looking at the premium cost versus
That's correct.
holistically looking at the additional cost that may come as part of the plan.
As a whole, yes, that's true.
Wonderful,
As a
wonderful.
whole.
Okay. Now I have a final question for you. And before I get to that final question, this is a reminder for everyone listening at home and our wonderful attendees that have stayed for this. Mrs. Aroona will be joining us at the Crescent Cary office all of next week. That would be let me double check my dates
Monday to
here.
Thursday.
Perfect. Yeah, Monday to Thursday, the 27th to the
27th,
30th.
28th, and 30th, yes.
Perfect. And there's a Calendly, a booking link that you can use. It'll be part of this video's description, and we'll also put it somewhere accessible. You maybe saw it when you registered for this video, but you can book an appointment with Dr. Aroona and come to the Crescent Raleigh office. and she'll be more than happy to assist you through enrolling for Medicare and kind of figuring out some of these questions and problem solving together.
Can I add something? Even if you have Medicare, a lot of time people don't read the book because we are required to leave a book. For example, if you sign with Plan A or Plan whatever name, I'm required to leave a book with that include your benefits, that include your summary of benefits, all the costs. People never open it. So I will advise everybody, please go through your book and look what your benefits have. Because sometimes, you miss a lot of things that you don't know, like gym membership, dental, vision, over the counter. They also have a flex card, every insurance that give you incentive when you do something healthy. For example, if you went to see for a physical, if you have a flu shot, if you have gym, if you 10,000 steps a day, that will give you a dollar amount for that. So that card can load up to $150, up to $150 on that card. So you can use that and you can add that money and you can use towards your lunch or dinners or things like that. So there are different options. So please do look into your benefits. If you don't understand, you can call your agent. They can happy to help you out. So I see most of the time when I go back to the same house, the book is still sitting at the same place where we left it. So please open and look through. If you don't understand, call it because you are missing out a lot.
Definitely look at that book. Okay, that's good to know. I'm going to see if my
Yeah.
parents have that book in the
Or you
same
can
place.
now they have, sorry to interrupt, there is a barcode or there is a QR code on the card. When you get a card, membership card, they have a QR code now. You can scan that QR code and you have the book, your benefit in your hands. So that make it very easy for everybody. And I always will encourage everybody to go and download the app on your mobile phone. This way you can see if your doctor is in the network, you can see what claims you have, if your dentist is in the network. So a lot of information is there. So you don't have to call that 1-800 number and ask them. You can go on your app and find out things very easily.
Okay, wonderful. So look at that book, scan the QR code, download the app, see what other benefits and products you take advantage of. Fantastic.
Yeah, you don't want to miss, because then next year come and the whole of the last year will be gone. So you will not be able to get those card back.
I think
Another thing about
yeah.
thing I forgot about the OTC, the allowance, it expire every 3 months. So
Okay.
from January to March, if you don't use that, you can use in April. So in April, it start over again. So it's no rollover.
So it's a use it or lose it kind of thing on that OTC.
That's correct. That's correct.
Okay.
Mhm.
And give me a couple examples of what the OTC coverage might be.
The OTC coverage, it stands for over the counter.
Right.
So if you go to CVS, for example, you go to CVS pharmacy, you see cough drops, you see Pepcid, you can see bandages, you can see nasal spray, things like that. They are called OTC. Sometimes they
Right.
have weighing scale, they have blood pressure monitor, they have all kind of stuff that you need without the prescription. So there is certain amount that you can pay every you can buy. For example, if your allowance is $40, you want to purchase something $55, then you can pay the $15 extra. And most of the time, they are delivered to your home. So what I do,
Wonderful.
I always go online and I pick my products and I sign up and they come to the home. So you don't have to go and watch and look through which is over the counter, because a lot of stuff in the pharmacy is not OTC eligible. So that's
Yeah, I
very
think
tiresome to do that. Yeah.
I think I remember we have a brochure at home from CVS that says these products are all OTC, and then you can mark which ones you want.
But if you go and create an account, you will only see those products that are they are available to
OTC.
you. This will be good for you. Yes.
I think maybe both of these about reading the book and the OTC thing kind of cover my last question for you, which is what's one piece of advice you would give to someone that is approaching Medicare age? They're not yet enrolled, but they're about to hit Medicare age. What a piece of advice would you give to them?
First of all, don't get scared. It's not that confusing if somebody's taking your hand, holding your hand, and walking you through. The second is, you should apply. There is a window of 7 months. So 3 months before your month of birth and 3 months after the month of the birth, where you can apply for Medicare. So don't wait. Apply as soon as you can so that you have enough time to start your Medicare plan, whatever you pick, Medicare Advantage, Medigap, or just prescription drug plan, so you are ready to transition. So don't think or don't wait, and don't wait to the last moment, because sometimes Medicare approval take more than 3-4 weeks or sometimes 6 weeks. So you don't want to miss that window, because your countdown will start, your premium will start on the month of your birthday. For example, if you're born in September, you apply in October, they will still charge you for September. So you don't
Wow.
want to do that. So because the Medicare start on the month of your birth.
Okay.
September, October, November, December. So if you turn 65 in September, make sure you start that. And then once you sign up with Medicare, make sure you cancel your Obamacare or any other insurance that you have.
Okay.
Because I
Good
have
to know.
some get that, and then it's a big problem for them afterwards.
So good to know. Some wonderful, wonderful advice. Thank you so much for joining us in this session. I'm looking forward to our next session on the Affordable Care Act, or known as Obamacare. Looking forward to covering a little bit more about those premiums and how they may differ from this. And of course, excited to see you in the office next week as we tackle some of these questions for our shared clients together. Thank you so
Thank
much,
you so
Dr.
much.
Aroona.
Thanks.
We'll talk to you soon.
Okay.